just reach out like that, okay? As therapists, discovering an effective new means of advancing our professional capacities speaks to the very heart of our passions for healing. By unleashing the natural properties of healing, the UE Ranger personalizes the assurance of fulfilling your patient's greatest hopes, propelling you forward in today's complex healthcare environment as the most qualified leader for your community and for your referral sources.
This devotion to professional delivery has generated a powerfully new therapeutic tool in the Upper Extremity Ranger, making cutting-edge healing science deliverable both clinically and beyond. Matching the state of today's healthcare, empowering therapists to expand their professional value into their patients' homes, turning precious time into a therapeutic benefit without expanding cost is the most efficient means of rehabilitating the upper extremity. Naturally supporting the properties of healing within personally graded progressions provides a seamless transition of functional recovery being cared for at their greatest depth of need. As a result, therapists and patients alike are praising the UE Ranger for its efficiency, clinical impact, and cost savings.
I've seen other people who have had shoulder surgery who had not gotten into the range of motion that I was getting into. So I know that this device is very essential for the rehabbing of the shoulder. I think that being able to use the UE Ranger at home has helped tremendously in getting my shoulder back to my full range of motion in a shorter time.
To provide clinical insight on recognizing the path forward of advancing proficiencies and your due reward, business-wise and professionally, let's hear from the developer of the UE Ranger, physical therapist Dan Miller.
Whether we are treating to resolve pain, restore mobility, or to functionally strengthen, there is a universal thread impeding each of our patients' greatest hopes of fully recovering. This thread is motor substitutions and their interference of our every attempt at restoring health to motion.
This subtle yet powerfully limiting force occurs at the very interface between an intention of moving and the actual beginning of movement. It is often hidden under reflexive bracing of the neck or the holding of one's breath, and thereafter as motor substitutions as movement progresses.
In our quest to be most efficient with restoring movement health, we must first acknowledge that the most sensitive relationship in the greatest need of healing is that of the autonomic nervous system's influence on movement production.
Within the naturally supportive capacities of the UE Ranger, you can now gain the trust of your patient's nervous system and then therapeutically treat with your full knowledge and skills, versus working harder and harder against this relentless barrier of protection. I hope this sounds refreshing, because the truth is, you are already working hard enough.
Like any tool of value, the merit of the UE Ranger will be weighed by its capacity to fully accomplish the intention of its users. For the therapist and their patients, this intention is to fully heal, making this particular clinical tool an instrument of healing. Clinically and at home, let's watch this happen before our very eyes. Gaining the trust of your patients with an external support postoperatively begins with the assurance of feeling secure, and better still, transitioning with a natural sense of being at ease. Within the versatility of the UE Ranger, to personalize each patient's specific needs allows you to duplicate the trust they have either gained in their sling or through your manual support, and thus providing an excellent beginning point.
Advancing this established sense of trust progresses with the all-important initiation of movement. At this point, as can be seen by both the support of the therapist and that of the patient's non-involved arm, a patient's apprehension is alleviated, and thus motion is both passively achieved and recognized by the autonomic nervous system as a physiological support of healing. Note the accomplishment and preservation of the humeral head moving independently of the scapula is a neuromuscular communicating event, eliciting a calming response of a person's resting tone and a resultant physiological benefit to healing, including circulatory enhancement of oxygen-rich blood and resolution of pain and inflammation. Gone is the necessity to improvise with forward bows and pendulums. You are now assured with therapeutic value to both passively and meaningfully nurture the essential components of healing. while simultaneously restoring the reflexive foundational principles of preparatory motor control. As confidence is gained, motion can naturally progress distally as well as with reduced support from the non-involved arm. Further, as a patient exhibits a command of the natural support, motion can be progressively graded into varying degrees of elevation as well as through varying planes of passive exploration. Note, as with all therapeutic interventions, a close eye should be kept on the part of the therapist as well as the patient for signs of fatigue and/or onset of pain. As the passive influences are established, each patient will be guided with an appropriate sequence of a warm-up, challenge, and finally a cool-down as indicated.
When transitioning from passive range of motion to active assistive, it must be recalled that all postoperative shoulder patients will have retained a certain percentage of their pre-surgical history in the form of pathomechanical motor memory. An analogy I utilize to teach postoperative patients in their recovery of coordinated movement health is much like buttoning our shirts, meaning we need to start in the right hole to end in the right hole. This also holds true for persons living with either chronic neck or shoulder pain and its associated pathomechanics. If movement begins with a compensation, once in flight, we cannot remove the onset of a substitutive motor response. We would need to start over and recognize the parameters of preserving the required therapeutic threshold within each patient's current capacities. As a patient's presentation of motor control, including activation and endurance, are revealed, specific portions of the rotator cuff, as can be seen here with the isolation of the frequently inhibited supraspinatus, being neuromuscularly re-educated for its critical role as an early force couple to the deltoid. As recovery progresses, respective roles of the remaining rotator cuff and broader shoulder girdle can be progressively targeted for their dynamic roles and immediately integrated into greater and greater functional expansions of each patient's specific needs.
A second analogy that offers clarity for patients grading their strength recovery is the comparison of a dimmer light switch and a standard on-off switch. For a weakened portion of the motor system to recover, we cannot accelerate the pace of efforts from off to immediately on, as this approach reminds the recruitment of substitutions to resume a compensatory response. Instead, as nature's law of the motor unit describes, to nurture the process gradually like a dimmer switch. Gone also is the necessity to improvise with biomechanically strenuous table slides, rigid bars, and functionally deficient pulleys. You are now properly equipped with therapeutic value to meaningfully assist and effectively prescribe gradations of strength recovery in support of restoring functional endurance. A common point of vulnerability is between 60 and 70 degrees of elevation, as the rhythm of the scapulohumeral relation is necessary to support progression beyond this height. Recognizing a patient's point of compensatory inclination offers an interval of specific training to be devoted to, prior to advancing to higher levels of recovery. In other words, if a patient with active elevation begins to hike their shoulder at 70 degrees, support their motion beginning at 65 degrees, and create a training segment from 65 to 85 degrees, building until resolution of this interval, indicating a progression of capacity. Note the straddle stance of the legs and the freedom of the therapist's hands to mobilize within a functional transition of movement, offering kinetic foundational support of both energy transfer and dynamic relations. The intent for all concerned is to preserve highly favorable outcomes while acknowledging our present-day cost savings requirements. Achieving this end goal is ultimately accomplished by educating and properly equipping patients with the necessary means of more substantially contributing to their own recovery.
The UE Ranger has been amazing for me. I actually don't dread doing physical therapy, and I immediately feel the benefits of it, which makes me want to use it even more.
The UE Ranger offers you and your patients a healing vessel to carry you through these intricate processes of achieving an optimal recovery. Wishing for you all the best.
In today's market, Striking such a balance between passion and deliverability is now more than ever made possible by the versatile capacities of the UE Ranger. Order today and begin transcending hope into assurance.